An average person, obute handbag ya, iga omeprazole in ya. Iji also gonna ulcer. I don't know where they diagnose this ulcer. And the commonest thing that somebody will just tell you, H. pylori, or D positive. Money cut blood, or D positive. H. pylori is not used to diagnose ulcer. Whether it is positive 1000 or it is negative, it makes no difference. I don't know if you understand. For you to say that H. pylori, H. pylori is present in more than 85% of people. So if you do 10 people H. pylori, at least 8 or 9 of them will be positive. It's normal thing that we find in our environment. And by the time you do that test, it's not telling you that that person has the H. pylori now. It's telling you that this person has been exposed to H. pylori. So what you are checking is the antibody. Because of that, also again go ulcer kit, also again go nka, and you die just don't this ulcer, you know they go, but onye mepere oji gestid, oji omeprazole, oji nke ọzọ. I don't know if you understand. By the time you discuss with somebody, just one discussion, also again ulcer. And again, what is this ulcer? Ulcer. What do you understand by ulcer? Ulcer is a medical name for injury. That means there is an aberration. There is small thing, that is a crack. And this ulcer can only be present mostly. It's either it is in the stomach or in the duodenum. I don't know if you understand. And that's why you talk about gastric ulcer or stomach ulcer or duodenal ulcer. Now, this ulcer, are there things that we can do to reduce too much consumption of drugs? Small thing that will happen to somebody, ongo paracetamol, ongo diclofenac, ongo ibuprofen, this person is having a menstrual cramps. Proper hydration or something can help. And most times you will go to chemists and they will mix this one, mix this one, mix this one. All those drugs, directly or indirectly, has something to do with kidney. If somebody have headache, he might decide to take water. Before you take any drug, it's not about I have infection. If you say somebody has infection, you must tell us where that infection entered from. And that will determine the type of drug to be given to that person. Does that infection enter through the lungs? It has a different drugs. Does it enter through the urinary tract? It has its own drugs. Is there a wound? It has its own, yeah. So when we go back to that ulcer, if we say this person have an ulcer, the number one diagnosis, how you can find out for sure that somebody has ulcer, is to do what we call what? An endoscopy. But all these things, H. pylori, ulcer, it's not true. It simply means that, yes, this person has been exposed to Helicobacter pylori. So it doesn't mean that the only ulcer. My concern is not that people cannot have ulcer, but my concern is that there are so many drugs we are consuming, which is not necessary. And eventually, one or two of those drugs are implicated in causing what? Kidney disease. Some of them can cause liver disease. Some of them can even cause heart failure. But I want us to concentrate on this kidney. And if, for example, somebody can take water or rest if you are stressed and the headache will stop, why are we going to take ibuprofen? Eventually, this ibuprofen has to be acted on by what? The kidney and the liver. If we reduce what we take, for any drug we must take, whether pregnant or not pregnant, must be justified.